Good morning. It is Friday. I can't believe it. It's time for another little get-together coffee break with some of my Friday friends. I've got a couple of my friends from the circle joining us. So for those of you who don't know, my name is Nicole Broadhurst. I am a healthcare administrator turned independent patient advocate, founder and CEO of Tennessee Health Advocates, where we help busy, committed professionals take control of medical bills without the frustration of medical billing departments. So if you do know me, you know that I enjoy getting together with some of my friends on Fridays and talking about what's happening in the independent patient advocacy world. And one of the things that happened earlier this month was the Health Advocacy Summit in New Orleans. And so we in the circle, we get together every Wednesday. We are having a panel discussion this coming Wednesday with some of the advocates that were able to participate in that conference. So they have joined me this morning to kind of give a sneak peek and a look into our discussion on Wednesday. Nancy Keller and Cindy Johnson are both with me this morning. Let's go ahead and kind of change that. There we go. There we go. Wanted to kind of do a quick introduction. Hey, Nancy, Cindy. So wanted to do a quick introduction to my friends. Nancy, why don't you go ahead and tell us who you are and where you're stationed or where you're from and what's going on and what you do.
Sure. I'm Nancy Keller. I am a medical scientist turned board certified patient advocate. I am the founder and CEO of Stepwise Patient Advocacy, and I'm based out of Tucson, Arizona. I specialize in medical navigation and am looking forward to sharing our experiences.
Awesome. Thanks so much for being here this morning, Nancy. I appreciate it. Cindy, tell us a little bit about yourself.
So I'm Cindy Johnson. I'm a retired nurse, board certified patient advocate, certified senior advisor. I'm in Southern California, right? This morning I'm in La Quinta, which is the desert. So we're finally cooling off here. I am the founder and president of the Patient Advocate Agency. I've been in business for 5 years, and I focus on medical navigation, care coordination, and medical billing and health insurance appeals and claims.
Love it. Yeah, Cindy and I have talked we just were talking about some CPT codes on a surgical situation that she just had recently. So how's that going? Is it going okay? Like you got what you needed?
We submitted it back to the insurance company. So they said 30 to 45 days, but
perfect.
Frustrating experience when doctors will not provide any CPT codes. So
I know it can be really frustrating, can't it? So let's kind of talk Wednesday. If you're interested in joining us for the full panel on Wednesday, you can visit www.thepowerfulpatient.com. And you can register to join us on Wednesdays to talk more about this. So one of the things that we're going to be talking about this week is this Health Advocacy Summit. So this is kind of cool because Nancy actually participated live and in person in New Orleans, and Cindy was able to participate virtually via links and video conferencing. I don't know exactly what platform they use, but that's how she was able to participate. So I'm going to ask really quickly if each of you would just give us your biggest takeaway. What was the one thing that you took away from the conference in New Orleans that was most helpful for you? And I'll give you just a minute because I know we didn't really prep for that. Let's start with Cindy. What do you got?
I think the biggest takeaway I got was learning about, obviously I know about independent patient advocates, but also learning about the roles that the advocates at work or the navigators for different institutions. And I think in how we can work together with them, to help our patients, make it more collaborative and understanding what their role is, where they come in, and then how we can also go into that role with them and have a better outcome for patients.
Yeah. So what I hear is more resources, and I think as independent patient advocates, that's one of the things that we bring to the table. as a whole is making sure that we have awareness around all of the available resources for everyone, right? And that's a place that we live, and we're able to stay attuned to that in a way that most general population and patients just don't have the time to do. So I love that. Thanks, Cindy. What about you, Nancy? What was the one big takeaway for you?
Gosh, let's see if I can make this short, because there's a number of things that came from this meeting. I think the biggest thing for me was to understand patient access to specialized medicines and specialty pharmacies, the roles that they play in helping patients get medications. And one of the things that I would like to specialize in is the rare disease field. And so a lot of the patients need those medications, but you can imagine some of them are just like the diseases, they're rare. So they are extremely expensive. And there are a number of ways. Cindy, you mentioned some of that. There is, of course, the patient assistance programs that different pharmaceutical companies have, but there are also funding mechanisms that provide monies to people for specific disease states. And I can share a little bit more about that on Wednesday. But that was one of the things that I really had no concept of, and how intricate and how complicated it can be sometimes to get these medications.
Yeah, I love that. So true. So true. So listen, thank you so much. We have Barbara just popped into the waiting room. So I'm going to go ahead and add her to the stream here. Welcome, Barbara. Glad you were able to make it this morning. How are you?
I'm fine, thank you. How are you?
Good. So for those of you that don't know, this is Barbara Gaynor, and she's also going to be participating in the panel on Wednesday in the Circle. So I'm going to give you just a quick moment to introduce yourself, Barbara. Tell us a little bit about who you are and what you do.
Fine, thank you. Thank you for having me. So Barbara Gaynor, I'm a nurse. I'm a legal nurse consultant and also a board certified patient advocate. So my desire is to help people as best as possible navigate this healthcare system.
Love it. Thanks so much. And I appreciate you taking some time. We just kind of went through, and Cindy and Nancy gave us their big their big takeaway from the Health Advocacy Summit in New Orleans, which you also were able to participate in. Now, did you participate virtually or in real time, face to face?
I was able to participate virtually, which was really nice. I didn't get a chance to see a lot of things, but three of the areas that I attended were very, very good. And please excuse me, I wrote them down.
I write all kinds of stuff down.
So one area was with Ashton. She presented the neurodiverse, which has to do with autism, which was really, really interesting to me because my godson presents with all the things that she's talking about. So I was able to share this information with his mom. And so at least we know now how to navigate with him. The other one was how to become a badass advocate. And by Erin, she's a pharmaceutical rep, but she does the education part of it. And she gave her story with regards to her sister who had lymphoma like her father. She unfortunately did pass away, but how to navigate that care from a caregiver perspective on what things to look for and what to do. And then the other one was with Robert Mallory, and he was talking about negotiation and meditation for healthcare advocates. How do you help the families when it comes to negotiation and mediation for families and stuff? So
nice.
I can go over some of that. I'll prepare more to go over that on the Circle on Wednesday.
Thank Thank you so much. Oh my gosh, ladies, thank you so much. This is just kind of a sneak peek. Like I said, if you are an independent patient advocate or considering becoming an independent patient advocate, we invite you to join us in the circle on Wednesdays. You can go to www.thepowerfulpatient.com. You can register there and then hang out with us on Wednesdays. We always have a good time, and we always share resources and backgrounds, and we help each other become better advocates for those that we serve. So this Wednesday, we're going to be talking about, we're going to have these ladies on a panel. They're going to share their experience and what they gained at the Health Advocacy Summit in New Orleans earlier this month. So join us. Would love to see you there. Ladies, thank you so much for being here on this Friday. Go have a great Friday and a wonderful weekend.
Thank you.
Thank you.
Bye.
Bye.